most famous physical therapist on the internet.
Hi, I'm Brad Heineck, physical therapist,
I'm Chris the Pharmacist.
and together we are the most famous Bob and Brad duo to become healthy, fit, and pain-free.
In our opinion, of course.
Today's title of this video is Opioid Pain Meds. How they stop pain, why they're so addictive, and we're going to get into recovery as well. This is going to be made easy to understand. Chris is going to explain this to us in a technical way, but he's going to also back off on that and show us in a good way that the layperson can understand this. But before we go any farther, we do need to talk about our giveaway.
Let's give some stuff away.
Yeah. So this week the giveaway is the Flige Suspension Straps. They work excellent for exercise, great for body, core, arms, as well as legs that connect up to the wall. And you can look more detail at those if you go to, let's go to our infamous, there we go.
There we are.
For the giveaway, go to bobandbrad.com. You can go there, click on the giveaway tab, and you'll get to that with all the complete information. Also, you can sign up for the giveaway at Bob and Brad on Facebook. It's pinned to the top of the page. Don't remember that. We also have our information on other sites such as Twitter, Instagram, and the infamous TikTok.
Boom.
So, very good. Opioids. Man, no matter what, you hear a lot about opioids. As a therapist, you know, we use them for pain meds,
Yep.
And they're used widely, but they got this big problem of opioid crisis, which means, well, we're going to get into that, but it's a problem, and it's a big problem, and we need to know how to use these or understand these so that we're not afraid of them,
Yep.
but we respect them and use them well, and doctors are very well aware of this. So how do opioids, first of all, opioids, what are we talking about? What are the common names that we hear?
Well, there's a whole bunch of them that can be used. I mean, the most common ones are probably going to be oxycodone.
Yep.
Then we're going to use hydrocodone with acetaminophen. You can use oxycodone with acetaminophen. You can use fentanyl patches, and there's actually sublingual lozenges. There's a lot of different things. Most commonly, those are the ones you're going to use the most. But you can use morphine. Morphine is really common.
That's an opioid.
Opioid as well.
So all
it's kind of the grandfather one, soldier's drug. So
Sure.
it's the first one that really came out.
So all of these
Civil War
opioid drugs fall into this opioid category, and they have these names which are very common. I know the OxyContin, oxycodone, very common with total knee replacements in the past.
Very necessary.
Right, exactly. So as far as the names, why do these work? How do they work? As far as, can you explain it in a layperson's way?
Yeah, it's kind of interesting. I mean, you have receptors that go through your brain, your spinal cord, and even your gut. And there's actually, within those receptors, there's a breakdown of those.
So receptors, we're talking about the nervous system.
Yeah, it's just kind of like a little puzzle piece. So you got pain reliever,
yep,
receptor. It locks in like a puzzle piece. And the most important, there's pretty much 3 receptors that are widely studied. And the mu is the one where it's at. That's the one that has most of the pain relieving properties. And then you have lesser ones that you would call delta and also kappa receptors.
Yeah, that's getting kind of...
It gets a little technical.
So the puzzle thing, we're talking about these things come together, and that gives pain to our brain.
Yeah, so as soon as you take the medication, goes into your gut, gets into your blood system, in about 15 to 30 minutes, you're going to start to get analgesia, which is pain relief. And you still have that pain. So let's say you broke your wrist. It still hurts like crazy. You just don't care about it. That's what pain relievers do. So
you mean all are opioids?
Yep, any opioid. Yeah, no, I guess. Yeah, we'll use opioids and pain relievers synonymously for this, just to keep it as simple as possible.
Yep.
But the problem with opioids and where we have the crisis is pills can lead to addiction and can lead to seeking some of the street drugs like heroin.
Let's back up. So let's go to knee replacement because they're very common in my world.
Sure.
You're on opioids. It hurts like crazy. You got to range it out. It hurts. But if you don't get it moving, it's going to contract and scar tissue is going to be a problem. But so we have this connection of the puzzles come together so that the pain goes from the knee to the brain, gets pain. The opioids
blunt that effect.
Yep. So that's all good.
Yes.
Yeah, so we're going to take those. We're going to get good therapy. We're going to be walking again. So where does the problem come from, this less pain or pain you don't care about, into a
problem.
A crisis where you're addicted to it.
Yeah, it's kind of funny when you talk about that, because especially like if you take a total knee, that type of therapy is going to take time to go from A to B. I mean, how often do you see your
Well,
patients?
Typically a 4-week regimen. It can go, less than that. It can easily go more than that, but we use 4 to 5 weeks, whatever.
Yeah, and so the newer studies, it's very interesting. We had maximal prescribing of opioids that kind of it hit the peak in 2012, and we see a very dramatic decrease to where we are today.
Overall use,
prescribing of these
prescription.
opioid painkillers.
Sure.
And so it's been fascinating. They're harder to come by. You don't see the forgeries. You don't see the seeking behaviors as you do. So to treat your patients, what doctors are doing now is there's the number 3 and the number 5 are very important numbers. So a lot of surgeries, when you doctors are only prescribing, these are kind of FDA guidelines.
Yeah.
You get 3 days of narcotic pain reliever, and then the doctor will review you and see what they need to do next. Because it seems like going up to 5 days, there's a lot more continuation of the use of those opioid pain medications. So it's interesting when you have somebody that's on a total knee. I mean, you want to transition from using something like hydrocodone or oxycodone for pain relief to getting over to like Tylenol and something like ibuprofen more rapidly if you can.
But let's go back. So where's the problem? Why do people get addicted, and why are people dying from it? How do they go from the prescription medical use for it to this crisis of opioid addiction?
Yeah.
So where does that happen?
So remember we were talking about that puzzle piece?
Yep.
There's one main puzzle piece, that one where I said that weird word moo, kind of like a cow. Well, it hits that. Not only does it give you the analgesia, but it also gives you a euphoric response. So, and not everybody's going to be...
So you get a buzz.
You get a buzz.
Yeah.
And so, and it basically, and when you're in pain, you don't notice this. And actually 97% of patients don't have a problem. It's that 3% that can create, that's where they can get hooked.
Would that be like an addictive personality?
Yeah, there's a lot of factors. I mean, are you in a transitional stage in your life? The younger you are to start pain medications, is there family history, genetics?
Sure.
So there's a lot of things that build into addiction science that make it very, very challenging. So, I mean, for the scope of what we're talking about is what can we do to keep ourselves safe? And it's using them as prescribed by your doctor, what your pharmacist recommended you take it as, and using it for the shortest possible period that you can.
So if you're on opioids for more than a month, is that kind of a general, that would be pushing the limit?
Pushing the envelope. I mean, we want to try and, you get up to using opioids regularly for a month, you're going to have to walk down, because otherwise you're going to go through withdrawal. At that point, you are at least physically addicted on the medication. So
even the prescription.
Yeah, even the prescription. So if you're taking, I'm going to pick on hydrocodone with acetaminophen. You're taking, 1 tablet 4 times a day, every 6 hours. If you do that for 4 weeks, and all of a sudden we just say, Brad, I'm not going to give you any more medication.
Yeah.
It's going to be a bad day. So
just one day, or is that going to take a while?
Well, it takes about a week to flush out of your system. So so if we taper you off, so if we go from 4 down to 3 tablets a day for a week, and then maybe 2 tablets a day for a week, and then finally 1 tablet a day and off, that exit is very clean. And so, but it takes.
So if you do that, then you're probably not going to feel addicted. You're not going to want it anymore.
No.
Unless maybe you're in that 3%.
Yeah. And
okay.
Then there's other stats that we can throw out too that make it even more confusing. But I mean, for the most part, it's that 3%.
So as long as you follow, and you said now that, and I've heard this too from doctors as well as patients, they're less likely to prescribe opioids, and it's governed or monitored, regulated.
Yep.
Is this worldwide, or is this just in the United States?
Well, in the United States. And I mean, it's kind of funny when you start looking at stats, but right now in the United States, we use a thing called the PDMP, which is it's a website that helps us, the Prescription Monitoring Drug Program.
Sure.
And so when we get an opioid that comes in, we have to log on and look at that, and then see what the prescribing history has been and the usage history has been.
Of that person.
Of that drug. And actually, prior to that, the doctor does the exact same thing. So our stories will match each other. So the doctor, before he can even prescribe it, in a lot of systems now around in our local healthcare area, they have to log on, look at the PDMP, and then they can actually select the drug. But if they don't do that step, I believe the systems will not allow them to write for it anymore.
So it's just a system to
it's a safety check.
Right.
Yep, just to make sure they're using it appropriately. Because, I mean, there are cases, cancer, arthritis. I mean, you're going to have people that may take these things forever. So it's tough. And so as long as they're used the way the doctor intends it to, it's not going to be a problem.
Right.
But when you use these long term, you're physically addicted to the medication, but it's not so much like a drug seeking behavior. You just, if we remove it from you, you're going to have withdrawal. So that's what I mean by addiction in that particular instance.
Sure.
Because there are also psychological addictions as well, where you just, the only way you're going to feel comfortable is if you're using the drug. So it gets very confusing.
So where does the crisis come involved? If people are just using it with their doctor, these things get out of the system through their high school kid. Isn't there some stats on getting into the medicine cabinet and taking it because these pain meds were good?
Yeah, they do, and that's where the rush comes from, and that's what people all want. So when you finally go from using the medication for medicinal uses for recreational uses, that's when we start to see this opioid epidemic taking place. And it's a pretty easy problem to fall into. I mean, again, there are reasons why addiction occurs. Did you have a genetic predisposition to it? Were there family problems? Were you, did you have an alcoholic father or mother? Did you have, you're in a transitional period in your life where you started at a new school, you started a new job? Those things just all of a sudden you just want to try and escape, and all of a sudden taking the medication, you just feel a little bit better about everything and you just don't care.
Right.
And that's part of the problem with it. And it's very easy to slip into that, and it becomes a very, very ugly rabbit hole.
Did you have some stats on who is getting addicted? Is it the patients? Is it
it's interesting. It's usually
family members who get to it somehow.
It can be anything. That's the thing. And like when you do the breakdown, I mean, it's like if you look at across the board, the younger you start and the longer you take a pain medication and the younger you start are strong predictors if you're going to have a problem with opioids or even other substances in your life. So we want to be real careful with that. So we want to be real upfront with our doctors. If there's a problem, you want to talk to your doctor. But when you look at some of the stats, high school, 1 in 12 high school seniors has tried opioids. Now, it could be heroin, which is a street drug, or it could be getting pills. And when you look at the breakdown, it's like, how did you get the opioid? And it first comes from family members. So they check the medicine cabinet. Somebody said, oh, I'm done with these. You can have them. So basically, you can get them from family members. You can get them, 35% get them from the doctor, but like I said, 53% get them from their
Now you said heroin, or so there's black market.
There are black market opioids. I mean,
so what are those opioids? Heroin and
heroin is really kind of, I think, the main one. It's cheap, so that's the problem. Back in the 90s when I came out of college, we had a very different mindset for giving people pain relief. It was just dosed to what they could tolerate.
You mean
side effect? Yeah, there's no ceiling with opioids. You can prescription wise.
Yeah.
Well, we started reining things in after about 2012, and so
there was 10, 20 years where there was a lot of opioid prescription,
kind of
high doses.
Wild West. I mean, I can tell some pretty crazy stories about involvement with the DEA and very particular uses for drug busts and on bad doctors, and so it's crazy.
Sure.
I mean, what people will go to no end to get what they want once they're addicted to these things. And so the problem with heroin these days is you start on the pills. Doctor won't give you any more pills.
Right.
I need something. I've just got this void in my body. I ignore my family. I ignore my job. I ignore my friends. I need to do something. Well, we find heroin. Heroin is cheap and it's easy to use. You can snort it, or you can inject it, or you can smoke it. So
and is it readily available in the street?
Unfortunately, it is readily available.
Sure.
And it's very, very dangerous stuff. 1 in 4 gets addicted to it right out of the gates. And so, I mean, and why is it so addictive? Well, it goes back to that mu receptor again. It kind of creates this incredible, intense pleasure for about 1 to 2 minutes after you ingest it. However, whether it's in shooting, smoking, or snorting, and then after that 2 minutes of that rush, then you have about 4 or 5 hours of just generalized contentment. You're kind of in a warm cocoon of happiness.
Yep.
And so, I mean, for a lot of people, that's very attractive. You just don't care about anything else. You're just kind of comfortable.
Sure.
The problem is after about that 4 hours, then you're looking for your next Jones or your next fix. The next time and then eventually the addictive psychology takes over, and you're just basically, most people, you don't even get the high after that first high that you try on heroin specifically, or chopping up and shooting opioids of any sort. You never really get that initial high. Now you're chasing it. Now you're just trying to not feel like garbage, which is that withdrawal effect.
Like the hangover.
Yeah. So it's a vicious cycle. And so it's one of those things you're always chasing that. And it affects the brain in such a way that when you go to rehab, they have to teach you how to think differently to break the cycle so you can make the healthy choices. So you're staying away from the people that can cause you to fall into these patterns, staying away from the situations that can cause it. So it's very complex and it's very sad. And
so is there any stats on how many people maybe start from the medical field,
Oh,
the
yeah.
prescription, and get into that illegal, the street drug?
Yeah, I mean, you got 2 million people right now walking around in the United States alone that are in what they call opioid crisis. So basically, at that point, they're hooked on it. So whether it's pain medications or street drugs, and so that makes it really really challenging to try and treat from that
Sure.
standpoint. But there's definitely avenues. And the biggest thing is when you know you have a problem, you have to reach out to a doctor to get help. A lot of times family members will try to break through, and the addiction is just so strong that they don't care. It's tough stuff.
So this is the kind of thing that can lead to death.
Absolutely. And even just, and that's part of the problem with some of the drugs that are available on the street. Heroin's cheap. Pills are expensive. I mean, you can get, it's $30 to $80 for a prescription pill to be sold on the black market, or,
You mean
illegal. One tablet.
one tablet that you could get from your doctor would go for $30 to $80
Yeah.
on the street?
Yep, exactly.
Versus an illegal
$10 bag of heroin. So, but I mean, you have people
and they're
that-
both going to give the similar.
similar type of high. The advantage of the pills is you know what you're getting. Things like heroin, you don't know what you're getting. I mean,
Sure.
they cut it with things. And one of the bigger dangers you have with drugs like heroin is and what we're seeing with the death rate rising so much. I mean, last year alone, 67,000 people died.
67,000 people
130 people a day die
from
to opioids and heroin. And
both street and from.
Yeah, they're kind of lumped together.
Okay.
And they actually have some pretty. The National Institute of Health has some really good graphs if you guys want to research it yourself. But it shows quite eloquently the dangers of these drugs. But the big scary one right now are the synthetics. A lot of times, in La Crosse, they just had a big fentanyl bust down by Gunderson. They're cutting the heroin with fentanyl, which is an extremely potent, way more potent drug than heroin itself. And they mix it in with the heroin, so people either melt it, shoot it, or snort it, or smoke it. And so from that
And
standpoint,
fentanyl is where do you get that from?
you get it from your doctor, but this is black market fentanyl. So it's
Okay.
coming from drug dealers. And so it's a powder, and it has to be, you can't really eat it. That's why in prescription, you have a fentanyl patch or Duragisa
Sure.
patch. You wear it for 3 days. Great for cancer pain. So it's something where it's a phenomenal painkiller, but when you mix it with something deadly like heroin, I mean, the death rates are even higher. It shows, and it's actually outdoing straight up heroin death rates now.
Wow.
So
Wow.
it's scary stuff.
So if you've got a family member or yourself, you know you got this problem, you want help. Obviously, it sounds to me like to get through the withdrawal is something to do by yourself is extremely challenging.
You're
Is
going
that
to need
correct?
help, yeah. And there's a lot of different ways. Some of them are a little bit controversial. I mean, you can get a medicated assisted one can get you off of the drugs. You actually literally go to a hospital, they check you in, they give you special medications to help your body, and they taper you down off the opioids
Sure.
till you're clean.
Yep.
And you're actually basically in a medically induced coma to get to that. So that's the most controversial one. Or they can do it, you can try cold turkey, but that's, 7 to 14 days of hell.
Yep.
Or you can get into a program. And so there's lots of programs that doctors can lead you to. And there's you can just look on the internet, just anywhere you want help for opioid addiction, and you will see multiple sites come up. And
Okay.
so basically they want to keep you safe and healthy.
Right.
And a lot of those programs they're incredibly successful, but they have to place you on medications to help to get rid of that
Right.
craving.
Level.
So things like Suboxone. So it's a drug that they use. It's a special film that they dissolve in their mouth.
Sure.
And so basically what it does, it's 2 drugs in one, and one blocks the receptor so that if you were accidentally broke down and tried to use something like heroin, it doesn't work. It
Oh.
doesn't work at all.
Oh.
And it gives, and gives another one to basically just kind of take the edge off so that you can function and feel normal.
Sure.
So it's amazing when you see a functional addict. I mean, they can take a hit of heroin and you look at them and they're talking, you wouldn't even know it.
Wow.
So it just
Wow.
kind of it's weird. But then there's other ones that are all gorked out and in left field. So
Right. So I wasn't really aware of that myself, that
it's strange.
people can be function while they're on opioids
Mhm.
and you wouldn't know it. And it's
No,
I
they're
mean,
just
could
using
this go on for days or years?
years
Years. People could be using this for years.
until they die.
And as they're using this, is their body slowly or their brain
The
decaying?
brain, yeah, it causes brain damage. So I mean, it's just one of those things where it's one of these things more than anything else. Your brain just all you want to do is seek that drug And all you can do really is nothing else exists other than
Sure.
the drug, and you're just going for it. So when you get to a doctor and you finally get to treatment and crisis management of all these things, they're going to work with you psychologically
Yep.
to try and teach you behavioral patterns
Yeah.
to help you to become safe and healthy again.
So do you recover? I mean,
Yeah.
say your mind, it gets beat up through all this
Oh, yeah.
use, but like I'm thinking like your lungs, after you smoke for 20 years, they get beat up. But after a few years, when you quit smoking, it does recover. Maybe not to 100%, but you
Yeah.
get fair. Is it the same thing with this?
Yeah, I think you could say. I mean, I
Or
think you
maybe
could
they
say,
don't know 100%.
you don't. I don't think you'll ever get back to 100% of yourself. But
Right.
you know, and you might have to have medical help with, as far as prescriptions, to try
Yeah.
and help you. There can be chronic depression. There can be anxiety issues. So there's a lot of different things that have to be looked at, and it's a very complex medical condition that requires a doctor and almost regular check-ins and visits.
Sure,
Sometimes
sure.
even weekly. Sometimes there are doctors in some of these programs that see people every other day.
But once you get further and further
Yep.
away and you've been
Yep.
completely free of using the drug, then you don't have to go as often. I'm assuming.
Exactly. I mean, once we get to a point, you know, and you stabilize on the medication, and then the goal after you get to a good point, hopefully then we try and pull you off of some of these things, and you just check in with counseling, and you kind of keep working on reevaluating, you know, life choices.
Sure.
And keeping in mind, a lot of folks relapse, and it's something that you have to realize that, you know, they can succumb to it, but you know, they can't look at it like a failure. It's a disease. I mean,
So
you
they
treat
can
it
be
like
off of it,
and
and
then they can fall
could
off the
get-
wagon, so to speak.
Okay, sure.
But they can get help, and they just have to reevaluate and retrain the brain
Yep.
to try and avoid those and make better lifestyle decisions.
Mm.
So whether it's going into an exercise program, where you know, you've got to find something to fill that void.
Yeah.
Because what happens is when you get into that, you burn out all the receptors that help you to feel normal.
Yes.
And so you have to retrain your brain. You have to come up with activities that are going to help you to
Yep.
get back
Yep.
to that normal. What is your new normal?
Whoa, wow, we really went through a full cycle through the whole idea of how does it work to get to that total knee with that painful rehab medically into the illegal drug portion, which it could lead to, and boy, and then you got to get out of it. So
It's heavy.
yeah, and there's help out there if you are in that crisis mode, if you are taking it for a medical reason, total knee replacement, shoulder problem, whatever it may be, you can do it safely. Be
Absolutely.
attentive to your
Yeah.
doctor's.
Work with your doctor.
right,
If there's
right.
questions, ask your pharmacist. We're gonna funnel you to the right
Right.
people to try and help you
Right.
to do whatever we can to keep
Right.
you healthy and safe. Again, for most of us, it's not a big deal, but there's a small portion, it's a huge deal,
Yeah.
and it can kill you.
And again, the younger you start, the worse it is. So pay
Yep.
attention to what your kids are doing. If there's a question,
Yeah.
you
Don't be
know,
shy. Ask
don't-
questions.
Right.
Right there. If you're a parent, you can't be a buddy. You got to be a parent, and sometimes it's not nice, and those conversations are very unpleasant.
Right.
But at the end of the day, it's about the people you love, and you want to kind of help them
Right.
as much as you can.
Very good.
And there's always help.
Outstanding job, Chris. It was boy, I'm learning here. We talked about this before, and I feel like I've learned something. I feel uplifted. So very good. I hope you feel the same way. And good luck. And I don't know what else to say, Chris, but goodbye.
All right. See you guys.